Good morning, everyone. I am Amal Faiz, a student at UPM. Nowadays, there have been a number of doctors who use social media as a medium for health communication to educate the public. Today, I'm going to talk about how health communication can be spread via social media. I strongly agree that health communication via social media is effective in educating the public. There are three main points that I will focus on today, which are providing information in crisis situation as intervention for health promotion and health education, and can help bringing the behavioral change among the public. Firstly, let's start by talking about how health communication via social media can educate the public. The first main point is providing information in crisis situation. Through social media, hospital and other healthcare organizations can easily update on the hospital capacity, operation status and emergency room, access through social media network during natural disaster or disease outbreak. For instance, when a natural disaster had hit Japan in 2011, Twitter was actively utilized by doctors to update their patient. Also in 2009, the US Center for Disease Control and Prevention used social media network to educate people about the H1N1 virus. So, health communication via social media is effective in educating the public by providing information in crisis situation. Okay, so now let's move on to the next point, which is intervention social media as an intervention for health promotion and health education. Okay, health intervention is any effort that attempts to improve mental or physical health by an organization such as the government or the NGOs, which is non-governmental organization. By health intervention, they can talk about variety of informative and common issues nowadays, such as obesity, spread of infection, spread of infection and disease, and even vaccination. By promoting healthy educational things in social media, they can reduce the amount of people that are affected by disease such as obesity and others. It is also mentioned in the research that 60% of the social media users admit that social media is the best and the most effective way to read about health education and promotion. So as an intervention for health education and health promotion, making the health communication via social media effective to educate the public. Moving on to the last point, how communication via social media is effective in educating the public by can help bringing the behavior change among public. Social media helps bringing the behavior change among people about the knowledge, attitudes, and healthy behavior. This change be related to previous unhealthy habits such as unbalanced diet or wrong belief may be related to preoccupied attitudes or aim at enforcing the existing belief of habits. Social media also can influence the behavior of people for the sake of better health by adapting to preventive measures which help the spread of disease and illness. For example, by drinking plenty of water and keep all sources from the sun to prevent heat stroke to occur. So, I strongly believe that can help bring in the behavior change among the public is one of the reasons why health communication via social media is effective in educating the public. To sum up about this topic, health communication via social media is effective in educating the public as it can provide information during crisis situation. Other than that, health communication also can be as health intervention for promotion and health education. Lastly, it helps bringing a behavioral change. So in the future, we can use this opportunity to improve our health, to lead a better lifestyle, and for our grandchildren. So that's all for today. Thank you.